For us in Nigeria here, alongside my colleague who just presented from the malaria program, we're looking to conduct a retrospective study on campaigns that have been conducted in Nigeria, integrated campaigns. Specifically, our case study topic is a retrospective study of lessons learned from the 2019 and 2020 implementation of measles and MEN-A integrated campaigns in northern Nigeria, especially in the context of COVID. And we've picked 3 states to be our specific case study, and their states in northern Nigeria being Kogi, Kwara, and Niger State. So this just gives you a brief overview of the project. Like I said, it's going to be retrospective and it's in 3 states in Nigeria. This is the outline that we're hoping we will be able to address through this presentation. Next slide. So for us, if you're looking at the rationale and the background to collaborative campaign planning, for us, the main purpose in Nigeria of campaign planning is to ensure that the resources required for that campaign are adequately provided for and used efficiently to achieve campaign goals. Now, if you look at it from the flip side of why then do you plan for collaborative campaigns, or why are you even integrating campaigns together? In Nigeria, following the incident of COVID, alongside a lot of disruptions that happened in the country found itself actually integrating campaigns. So there was an integrated measles and MEN-A campaign, measles and yellow fever campaign, etc. And so our case study is really looking at the integrated measles and MEN-A mass vaccination campaign, how it happened, and what lessons can be learned from that campaign. Now, if you look at what the rationale for an integrated campaign planning really is, specifically with Nigeria, this was born out of, one, primarily the disruption to routine immunization services that was caused by the COVID-19 pandemic. Now, the country already had a chronogram of plans of activities looking at the epidemiological data of campaigns that needed to be implemented. Unfortunately, we didn't have the time frame or even the resources following COVID. So really, the integration of campaigns, although it has been successful, was born out of the need for time, the need for cost savings, and the disruptions that had happened to the routine immunization program. Now, in terms of how the country decides what campaigns to be integrated, there are a few things that come into play. For example, with measles and MEN-A, there's a similarity in target population, thereby reducing the multiplicity of social mob. There is also similarity in the logistics planning, similarities in the antigen route of administration, and of course, a primary motive for this integration was the incidence and prevalence of the disease burden in the country. So in terms of the questions that we're hoping our case study would be able to address, we have 3 key questions. The first is, what collaborative planning approach was adopted for the integrated measles and MEN-A campaign in Kogi, Niger, and Kwara States, and what are the lessons that can be learned? Specifically, under that thematic area, we're also hoping to be able to answer what the priority considerations should be during the pre-planning, planning, and pre-implementation of integrated health campaigns. We're also hoping to be able to answer what challenges occurred, if any. The good thing about this case study is the fact that it's being studied retrospectively, and so we can answer questions that we might not be able to answer in a prospective study. So we're also going to be looking to address what challenges occurred during the campaign implementation, during the integrated campaign planning, and what strategies were adopted to overcome those challenges. Another key question that we're hoping to be able to answer is the specific approach that was adopted for the integrated campaign planning, looking at it in terms of both the processes and the tools. How were we able to develop shared data systems, shared integrated micro-planning, logistics, and all the other infrastructures that comes into play with campaign planning generally, and in this case, integrated campaign planning. So in terms of the additional questions that we're hoping to be able to answer through that primary question, those include what factors enabled the successful planning of the integrated campaign, and what are the barriers that came into play, during the planning also of the integrated campaign. And finally, we're also hoping to be able to answer what tools enhanced the shared campaign integration planning, if those tools were developed by the countries, if they were adopted from somewhere else. We're hoping that our study will be able to answer those questions. Now, the last question that we're hoping to be able to answer through this study is the stakeholders. How were the stakeholders integrated? What communication structures were adopted for the integrated campaign? So in terms of our case study, we're looking at providing this response through the lens of the process, the tools, and the stakeholders. So in terms of the sub-questions, we're also hoping we'll be able to answer questions around what structures were existing that enhanced the integrated planning, or what structures were established, as the case may be. We're also looking to be able to explore what frameworks were adopted by the country that enhanced the collaborative integrated campaign planning. For project location, it's in 3 states in northern Nigeria: Kwara, Niger, and Kogi, and these states were purposely selected based on the fact that they implemented these integrated campaigns during the COVID-19 pandemic. So it was easy, rather, to select them and learn from them. So basically, our case study is going to be looking at 3 key areas to collect our data. We're going to be doing a DEX review, looking at all the documented pre-planning processes, looking at all the tools and exploring all that. We're also going to have focus group discussions and also key informant interviews. In terms of the health program, specifically, this is the immunization program. For the government level, we have the Federal Ministry of Health, the National Primary Healthcare Development Agency, who is really responsible for the routine immunization program in Nigeria. And also in the 3 states we're going to be looking at, we have the State Primary Healthcare Development Agency. Other key stakeholders within government are the National Bureau of Statistics, responsible for the post-campaign surveys, the State Ministry of Health, and also the State Primary Healthcare Development Board. For implementing partners, we have the core partners, WHO, UNICEF, but there are also civil societies. We have the NCDC, and we have other expanded partners within the space like CHI, like the CDC, and a couple of other people who support this program. For other stakeholders, we also have community leaders, influencers, religious leaders. They are very critical to the implementation of campaigns in Nigeria, and they form part of the pool of stakeholders that come into play. And so for this study, we have identified 2 key advantages and 1 limitation that the study might present. 1, the fact that the integrated campaign has been conducted already, and the 3 case study states that we're looking at exceeded their administrative campaign targets. We feel that the lessons that we will be learning are tested and successfully tested methods that we could learn from. We also feel that this study will be able to provide generalizable evidence for integrated campaign planning to support, of course, implementation of integrated health campaigns everywhere else, and even beyond the immunization space. We're hoping that the lessons that we would learn from this would also come into play for the integration of other health interventions in the space. For limitations, because this study is going to be retrospective, whatever factors have not been considered during the integrated campaign planning for the 3 states that implemented might not be understudied in-depthly. They may be highlighted as part of the areas that should be looked into, but we might not be able to draw definite lessons from how those factors may have worked in the campaign. However, part of the things that we hope to be able to do is to highlight those factors that were not considered during the campaigns that were implemented in Nigeria as also part of the lessons that could be learned. For lessons that we can learn from this case study, specifically in Nigeria for future campaigns, is really what are the thematic areas to consider during collaborative campaign planning. looking at the tools. What are the tools that could be harmonized? How should the tools be harmonized? And how should they be used for decision making? In Nigeria, the country in recent times has been really big on the use of data for action. And so a lot of our lessons is also going to rally around how are these processes being used for decision making, or how does the planning process enhance decision making? Partnership and stakeholder. Recall that from inception, I had said we have designed the study to look at three key critical areas of campaign integration planning, which is the process itself, the tools and the system, and then also the stakeholders. And so we're also going to be learning lessons around partnership and stakeholders. Who are the partners involved? What are the modalities for integration for the stakeholders, etc. In terms of advice, just off our fingertips, one critical thing is there is a need for collaborative stakeholder involvement from the pre-planning stage. That's part of the things that Nigeria has done efficiently in the past 2 years, and the ripple effect of that is some of the lessons that we're able to document now and see. Again, another advice is, which might not be generalizable, but a top to bottom approach of collaborative planning may be effective depending on the country context. We've seen that work for Nigeria, and the case study would expatiate more on that. And so maybe other countries or other areas, other people who have similarities with our system might be able to pick that approach as one that works for them too, seeing that it has worked for us here in Nigeria.